Why would anyone take resveratrol? Let's break it down. Resveratrol is a naturally occurring polyphenol found in foods like red grapes, berries, and peanuts. It's best known for its role in what's called the French paradox, the observation that populations consuming diets rich in saturated fat had relatively low rates of cardiovascular disease, potentially linked to red wine consumption. But the real interest in resveratrol is not the wine, it's the cellular physiology. Resveratrol activates a group of proteins called sirtuins, particularly SIRT1. These are involved in regulating mitochondrial function, DNA repair, and metabolic efficiency. In simple terms, they help cells respond to stress more effectively and maintain function over time. Resveratrol also influences AMP-activated protein kinase, or AMPK, which acts as a metabolic sensor. When AMPK is activated, the body shifts toward improved insulin sensitivity, better glucose utilization, and increased fatty acid oxidation. There are also vascular effects. Resveratrol enhances endothelial nitric oxide production, which improves blood vessel dilation and overall vascular health. That has implications for cardiovascular disease, erectile function, and tissue perfusion. From an inflammatory standpoint, resveratrol downregulates pathways like NF-κB, which are associated with chronic inflammation. This is relevant because low-grade inflammation underlies many chronic diseases, atherosclerosis, metabolic syndrome, even neurodegeneration. Now, what does the clinical data show? Human studies are mixed, largely because of bioavailability issues. Resveratrol is rapidly metabolized and cleared. However, some trials demonstrate modest improvements in insulin sensitivity, endothelial function, and markers of inflammation, particularly in patients with metabolic dysfunction. So where does that leave us clinically? Resveratrol is not a primary therapy. It is not a replacement for exercise, diet, sleep, or hormonal optimization, but is part of a broader strategy aimed at improving metabolic health, reducing oxidative stress, and supporting vascular function. It has a plausible and evidence-based role. The key is positioning it correctly. This is adjunctive physiology support, not a standalone intervention. And like most things in medicine, the outcome depends on the context in which you use it. I'm Dr. Clifford Gluck. Thank you for watching. Please share these videos. I'll see you again next time.